Okay, excellent.
Okay.
I think we're going to go ahead and get started then. Good afternoon, everyone. Welcome to our sixth and final planned webinar for the Health Information Technology Learning Collaborative. Just a little bit of information on our agenda today. We are just going to recap a little bit on change management, a little refresh, get your reactions to the homework assignment on the webinar, and then we really are going to spend the bulk of our time talking about the change management that you're dealing with and your strategies and ideas for helping to facilitate that change management. If you have any updates that you want to share, progress updates since our last work group meeting, please feel free to share those. And if you haven't muted your line, if you wouldn't mind muting your line. Then we're going to spend a few minutes in the project wrap-up and just give you some final remarks around some upcoming opportunities to close out our project work together. So that's the plan for today. This is Laurie Call that's speaking, and you'll also hear from Anna Barnes. Anna and I have both been battling some respiratory issues, and today is her day for coughing. So I'll be doing most of the talking, and she will chime in as needed. So bear with us if you hear us break out in some coughing fits. All right, so just a quick refresh on some of the things we talked about in change management, and I really don't want to go into detail on any of this, but just refreshing and setting some context for what we're talking about today. But change management really is a structured process. It's not just, leaving it to chance and how we help facilitate change, but it's intended to be both a process and a competency, a set of skills that are needed to help move people through change and move projects and advance change, increase the likelihood of success with the changes that are being made. And it also is, there are formal processes that you can go through that really help you to facilitate that change more quickly. So those are, I think, some important things to remember and to note that this is a repeatable process and a set of skills that you can use over and over. And let me see. There we go. Okay. And we talked about on the last work group calls that there are 3 levels of change management. It happens at the individual level where we're supporting people through the change, helping them on their day-to-day by enabling them for success through their personal change that they have to make, how it's affecting them in their job or their day-to-day activities personally, and that's a really important component that sometimes we forget. The project level of change management, which is really focused on ensuring that we're increasing outcomes and return on investment by driving adoption and use throughout the organization or the area that we need that to happen. And then finally, organizational change management, where we're really trying to deliver strategic intent and improve ability to really embed the strategic change management into our organizational practices and policies and really have sustainability for that change. So a lot of what we're dealing with right now falls into all 3 of those levels. And there are things we need to think about the individual change, the project change level, and overall the organizational change. So you may not be working at only one level. When we're working at the individual level, we talked about the ADKAR model to support individual change. And I really want you to think about those that you're asking or you're needing to make some sort of change in their day-to-day work, the way that they conduct their business, the way they do things, the way things are going to affect them or impact them, that it's important that we follow this model and think about what's the awareness that folks need to have of the change, knowing why, the nature of the change, the risk of not changing. So that very first milestone around awareness and making sure that they fully understand that, really working on getting their support and their buy-in, their desire to participate and support the change. So they understand the rationale, they understand how this could be beneficial to them, how it could be good for them, the knowledge for how to make the change. So really supporting them in understanding what kinds of things they're going to have to do differently, having the training and the support to be able to do that, and allowing them to build their competency to have the ability to do these new skills or behaviors, or to implement that change, and then reinforcing that as we go throughout. So we really want to use this model to facilitate the change with individuals, to create a common language for the type of change, and to empower managers to support their staff through these types of change. So that's really an important part in understanding who your stakeholders are who are going to have to go through some of these types of changes, identifying them, and maybe the awareness and the desire, the knowledge, the ability, and the reinforcement is a little bit different for different stakeholders. So taking that into consideration. And then one thing I wanted to share that I did not share on the last call was from one of the resources that I mentioned, the book Switch by Chip and Dan Heath. And I think this is really important to take a look at, because it really helps us think about some other parts of the model. So they talk about directing the rider, motivating the elephant, and sharing the path. So for, we have to be able to, when we're directing the rider, follow the bright spots. So what's working and clone it in certain places. Scripting the critical moves or changes that need to take place. So don't always think big picture, but think about bite size in terms of the specific behaviors that have to change for what you're trying to do, and then pointing to the destination. So, keeping the eye on the prize, and change is easier when you know where you're headed, and that really also helps to build that desire to participate in the change, the awareness of why the change is so important. So those are around directing, and then motivating is find the feeling, knowing that something isn't enough to cause change, making people really feel something. So why is this valuable? Why is this going to be better? Really striking that emotional chord, shrinking the change down, so breaking that down so it's not as scary until you can see the different spokes. Well, it no longer spooks the elephant is what they're trying to say, but so the change is no longer scary. So again, it's back into those bite-sized pieces, and then really providing the growth and the training that your people need to be able to make the change. So cultivating that sense of identity, but also working with them to provide what they need to make the change. And then shaping the path is around what needs to change in the environment to support that change, what needs to be in place. So when this changes the situation, what needs to change there. So whether it's equipment, making sure that they have a computer that's fast enough to run whatever it needs to happen, a policy, some sort of change or cross-training, all of those things that really help shape the path to support that. And then building the habits for doing things that are different than the way they had done them before. And then finally, rallying the herd. So, it's the word of mouth, getting a few people to have good experiences with the change, who can really share and say, oh, it's not that bad, it's pretty easy, even I was able to do this, or it made my time so much faster. It was a heavy lift at first, but eventually it saved me a lot of time and entering data later. So whatever that might be, that helps to rally the herd. So I think those are some good reminders that I didn't share with you, but that also help thinking about some of the individual changes. And there's lots of great online resources, as well as I encourage you to take a look at the book if you're interested in change management. Take a look at the book Switch. So I've included the online resource link. And then in terms of change management on projects, we talked about preparing for the change, implementing and managing the change, and reinforcing and sustaining the change. And part of preparing is the whole why and who is it impacting, who are our sponsors that we need, and conducting a variety of different readiness assessments. The implementing the change is around developing change management plans based on those readiness assessments. So our communication plan, how we're rolling things out, our training plan for training staff, the sponsor roadmap for when we need them involved and engaged and at what level, coaching and resistance management plans. So it's really taking the time to think through some of these things in advance with your key leads on the project, and also involving staff where possible to develop those plans and assess that readiness. And then finally, reinforcing and sustaining the change. So how are things working? Many of you talked about pilots, collecting the data on that pilot and tweaking and improving, getting feedback from staff on what's working, what's not, how to help support more efficiency and effectiveness with adoption of the change, being able to manage resistance where you have it by anticipating that resistance or finding out what some of that is, implementing corrective actions when you get the feedback on what could be improved to make it easier, and celebrating successes no matter how small to feel that confidence as you move through. And then we talked about organizational change, and in organizational change, we're really looking at Kotter's 8 steps to accelerate change. So creating that sense of urgency, building your guiding coalition that's working through this, having that clarified and consensus strategic vision and initiatives, enlisting lots of staff to be involved and engaged in the process, enabling action by removing the barriers. So that's why we're asking you to think about the barriers to change and how you can overcome those, identifying and naming and generating short-term wins, and then sustaining acceleration and instituting change. So there's a lot more information on all of that, and I hope that you got to see that when you watched the webinar from the Elder Services of Merrimack Valley in how they applied Kotter's model. And in addition to Kotter's model, he talks about 4 change principles. And so I'd like to sort of pause here and ask for how that webinar went for you, what you got out of that webinar, key takeaways, what did you learn from how they applied Kotter's model. So we will pause here and open up your lines for any feedback on your homework assignment of viewing that webinar. If you have comments. So you can type in the chat log if you would like to add feedback on the webinar. If you weren't able to watch the webinar or view the webinar, if you could let us know that, so we won't keep asking you the same questions. But if you did view the webinar, we would like to hear a couple key takeaways that you got out of that webinar. Okay, we've got a couple folks saying they didn't have a chance to view the webinar. You can also raise your hand and we'll unmute your line. We did have to mute the lines because there was a lot of background noise. We can try to unmute those lines again. You tend to like to talk more than type. So Susan, why don't we try to unmute all the lines again? Okay, so we should be able to see who needs to mute. Thank you. Okay, so was anybody able to view the webinar?
Lori, we have a comment from Sound Generation, and I think, Matthew, if you were trying to speak, we were getting feedback from you. So if you can shut your computer speakers off, then I think we can catch you on the phone line.
Can you hear me now?
Yes, great.
And I'll just say this briefly because it kind of echoes that same comment. I mean, I think that the resounding theme that jumped out at me from that webinar and some of the material that presented is, you know, as we that really being planful in your approach and that model, you know, the model that was described in the webinar, it's just everything that you covered in your first couple of slides, whether it's directing, motivating, or shaping, or reinforcing, or celebrating, or concentrating. I'm continually reminded that when we talk about change management, it's easy to say, but we plan for a lot of things in a thoughtful way, and I don't think change is one of them. And really using a concrete model is really helpful. Even some of the visuals that were shared on that webinar and some of the visuals you shared prior, and I know Chrissy Anderson's on it, all of that resonates with me, and it just, you know, my takeaway and what I'm saying to everybody is, you know, from beginning to end, you have to approach change and using technology in these clinical settings in a really thoughtful way to make sure you cover everything from bringing people into the discussion as early as possible, not only to get feedback and course correct as you move through it, and you mentioned pilots, but also to kind of give a sense of ownership. And, you know, and I know we're going to talk about this a little more later, but that helps bring down some of the barriers and some of the challenges that we face when we implement change in the use of new technology or using technology in stronger ways, because people are generally saying, look, I'm busy enough, right? I have too much to do, I've got things to do, and I'm not going to embrace change unless I'm really feeling part of it. So, you know, those two things, making sure that you use some of the literature and some of the references that you pointed out and that were pointed out, you know, in implementation during that webinar, is to say, putting more thought into a change management approach is only going to increase your chance of success and increase the chance that your entire organization adopts it and embraces it rather than pushing it away. And I think that's one of the biggest challenges anytime we implement anything new or any new change, is that the first response is generally to push away from it and to say, I'm not, but I think there are processes and approaches that you can take to really maximize your success, and that you can never think about that in a quick way and think it's going to go well. You really have to use best practices, implement a plan, and follow that just like you would with a software implementation. Otherwise it doesn't work as well as you'd like.
That's exactly right. Thank you for that testimonial, and it's really important to hear your perspective. I wanted to also say that when you're thinking about cultivating champions and you're thinking about engaging people as early on as possible, I can tell you that the people that you dread engaging because they are the naysayers, they don't like change, or they're really negative, when you engage them early on, sometimes they end up becoming a champion, and they become one of the best champions because people know that if they like it or they support it, then it really must be something good. So I really encourage you to think about, who are those folks I'm going to have the hardest time getting to adapt to this change, getting on board, and also are somewhat influential with other staff, or at least have a really big mouth and can influence other staff.
Yeah.
So engaging them early on can be really helpful. Yeah.
I like that. Thanks for pointing. No, thank you, because I think the point you just made it just gave me another idea. I think bringing out the folks that you think are going to be most resistive and making them champions is a real way to strengthen your approach. You're absolutely right.
Yeah, because they aren't afraid to tell you what all the things are that they're worried about and concerned about. And so having a good conversation to identify what those concerns are so you can understand them and you can address them in, they may, sometimes it's simple things like, my computer's so slow already, I can barely do this, that, and the other. or I don't have any more time in the day, but if you're able to show them this is going to save you this much time later on, you know, they might be more bought in. So, you know, it's having them be actively part of problem solving, identifying the barriers and asking them what potentially would be a solution to overcome those barriers. They start to develop more ownership, and they help, you help to build their buy-in. Looks like we have a comment here, a couple comments too. So they're saying that the webinar presentation did a great job of linking the abstract ideas to concrete steps, how they look into context of the type of the work that we do. And Victor said that they're preparing to present Cotter's 8 steps as a process to implement PIMA Council on Aging as we move forward with tech systems changes. And Maryland says, important to Maryland has been utilizing Cotter's strategies, creating a sense of urgency is a major issue for us. Changes in our all-payer total cost of care systems are putting us in rocket mode. So really moving that quickly. Okay, great. And PIMA says they're presenting that to their exec team. Okay, so I got that. Let's see. Like Mikey in the live cereal. Yeah, look, Mikey likes it, right? That's why we want it. If the person who doesn't like anything likes it, then everybody might support it. Anybody else, any comments that you wanted to add about that webinar? All right, great. Well, we will keep moving on. Thanks so much for sharing and your feedback. And if you didn't have a chance to watch it, you can actually probably go 10 minutes in, and it will get you to the part where it starts talking about how they applied change management and Cotter's model. So that might save you a little bit of time. And you know, you can always watch your videos or webinars on a faster speed too. That saves you a little bit of time. So just one more tip for squeezing another thing into your busy days. All right, so for this next portion of the change management discussion, we asked you to think about some of the types of changes that you are needing in the near future to advance your work plan, and what the barriers are to making those change, and ideas you have to facilitating that change. So our goal here is to have you share with us the change that you're looking at, the barriers, and just kind of talk through some of those things and think about how you can use the tools, the models that we presented on change management or that you saw in the webinar to help you facilitate and advance through this change. So Western New York, we'll start with you. If you'll just share your change and how you think some of the tools might help to facilitate that change.
To be honest, let's see, what did we have here? So we're working with the portal, yeah, we're working with our templates. The barriers are the communication intent. I'm just reviewing what we said. Sorry. Yeah, so we were having some communication issues between the portal technicians. Some of them have like tough accents, and just having them understand what we needed versus what was on the portal. And so we have done all of this we kind of made this for the last month. We've already done all this, and it's worked out really well because now they had a pictorial explanation of what we were trying to say to them, and it really helped. As far as using the change management system, I didn't really use Cotter's or whatever, but maybe it falls into that somehow, I don't know.
Yeah, I think that, you know, it's difficult when we ask the broad question of, you know, what change has to happen next for you. Some folks reported more on, you know, what's your next activity or hurdle or step that you're trying to accomplish. And so if we think about what you've been working on, you know, the questions that I would ask you to think about of, you know, in terms of what you're trying to accomplish and do and implement, what's going to cause people, whether it's your staff, your partners, others who are going to experience some sort of change in the way that they conduct their business. So for example, when one of the, what about the people using the portal? Is there, is there any kind of change management you're going to need to help facilitate people using the portal?
Yeah, so we've,
that might be something,
we've worked with their supervisors, and then we provide all the training for them. And then we also provide the tech support. So once we've trained them and then they're working on it, we go in and make sure that they understand and that they just have access to us to answer any questions and stuff. But I did not get a chance to watch those webinars, so going forward, I will. And so then I think I'll be able to put more structure behind looking at different barriers and how to help our network members go through the change. Because I really wish I had all this about a year ago.
That's okay.
To be honest.
I bet. Well, it will continue to serve you well through the rest of your project, and I really encourage you to dig in a little bit into some of the resources. I think they'll help. So thanks for playing along with us here and trying to think through this. We appreciate it. We'll just move on now to age options, and if you'll just share with us what change you're trying to facilitate through, and if that's changed since you last submitted your slides, you can let us know. But kind of talk us through this and how you're facilitating the change.
Amanda, are you on this call? My TV. This is Rob. Hello, everybody.
Hi.
So sorry, I'm looking at this. So kind of one of our changes is really we initially intended to really look at whether or not we are keeping our data system due to financial budget things. We're not ready to make that change. So our shift has been to working for an increased buy-in of our partners in the data entry. The barrier that we're talking about in that element is really their time and really making sure that they understand the importance of their investing their time in that data. So we're actually, I think this is really good timing for us to work with them to really kind of buy into the process and to understand, to use this counter approach to really get them to buy into the process. Sorry, I'm a little short on details on this one right now.
That's okay. That's okay. I would go back, since you're probably looking at a lot of individual changes.
Yeah.
You might want to look at that ad model a little bit.
Okay.
When I looked at your slide, the question I was asking back is, what are the barriers for staff and partners to adapt to the change of tracking info in a different way, or to using the data management system? Thinking about those barriers, and in terms of change management, what do they need to be able to know around why that change is happening? How do you build their capacity and their confidence to use the different system? All of those types of things. How do you get over those barriers? So thinking about that and how you can use the ADCAR model to do that. Just wondering if you had any other ideas around that. Yeah, of course. All right. Well, we'll just move on now to
So this is Sue. Can you hear me?
And I'm on too. If you all want to ask me any questions, I'm here.
Okay. But I think what I'd like to share is a couple of approaches that we're using that are extraordinarily helpful. One is we have a strong relationship with our Maryland Department of Aging, a good relationship with our Maryland Department of Health. And as I noted, the changes that are occurring here in Maryland are really happening at the top level. And we really are literally in the midst of quite remarkable opportunities. But one of the things that we just recently did was to hold our 8th Living Well Evidence-Based Academy, and we focused specifically on coordinators who are implementing the workshops. Before this, we've had really a broad approach, but this time we really focused on coordinators. There's been a lot of change throughout the Aging Network parts of that. And the other piece that we did was to identify a champion, one of the AAAs, which is partnering with their local Department of Health, with their local hospital, and with others to begin implementation, and really highlighted their partnership rather than what we're doing at the state level. And people really resonated with folks. So it's not quite the same as that naysayer piece, but it really, it was someone who was just like them, who has been successful. Leanne, I'll turn it over to you to see if there's anything else you'd like to add.
I would agree with you. We, as far as my wise view goes, are getting ready to test that. So we're really looking at the way that we can collect information and not have to double enter. So I think that is kind of a barrier for us as we look at so many different databases. So that is going to be a change. We are also looking at our health and information exchange. So on the lower eastern shore of Maryland, we're going to be piloting getting all of our referrals through our health information exchange, as well as being able to put the information back the person has entered, if there's anything going on with the social determinants of health. So that is something that has been coming. So we're going to launch that in October. So that's a huge change for us. So we have the commitment of leadership moving forward, and with our departments of health and aging, we have a great deal of support. So is there anything else, Sue, that you would like to add?
No, I think that's it. Thanks.
That's great. Thank you for sharing that information. And I think the strategy that you talked about of having another a AAA come in and share their experiences is a great way to help add credibility and help people who need to, have that desire for change built up. It's a great way to work on that strategy and build that strategy. When you said, I think one of your bullet points under changes needed to advance, assisting with readiness of AAAs to enter contracts with healthcare, how to help manage this change. It sounds like by giving them an example of where it's worked and showing them that can be really successful and really helpful. The other thing is, in conducting those readiness assessments and getting input from users, from staff, from all those that would be involved, and then helping them to, working with them to identify solutions to fill the gaps with those readiness assessments is really important. And then you said under here, ideas to help facilitate change, the commitment of leadership moving forward. It sounds like you've done a lot of work on thinking about how to get that support and commitment of leadership, and particularly the partnership with the Maryland Department of Aging to assist with that has also helped you to facilitate this change. So thank you. Thank you so much for sharing. We'll move on now to the Oregon Wellness Network.
Muted? Because we can't hear you talking.
Okay, anybody work?
Oh, I had to unmute, sorry. Is that better? Can you hear
We
me?
heard you for just a moment and then
Can you hear me now?
Lavinia, are you speaking?
I am.
Okay, we'll come back to you. We'll come back to you, Lavinia. All right, move on then to sound generation.
Hi there, this is Megan. Unfortunately, Paige wasn't able to join in today, so I'm going to try and channel her thoughts on the slide she put together. And I believe that this slide speaks most directly to one of our 3 project goals, and it's the one that we're working on most actively right now. The other 2 are sort of on a scheduled hiatus, so to speak, where we're kind of waiting on externally defined timelines for those, so I'm going to set those aside. And the goal that we're that's on the forefront right now is an organization-wide data security audit. And this is something that we are doing in preparation for being able to work with healthcare across all of our different departments and sort of understanding how we fit in with HIPAA, if we do. I'm getting a lot of background noise. I don't know if I'm coming through.
You're coming through. Go ahead.
Okay, thanks. So we're looking at this organization-wide review of data management policies and practices, and this has actually stalled out right now because of issues we've had with getting contracts with a consultant, and so the timeline has definitely slid. However, reflecting on what we've learned from the change management webinar, I know there's going to be a lot of really juicy organization-wide change management to strategize about when this process does get started in earnest, because we expect it to produce a lot of specific recommendations for changes that we need to implement in policies and practices in every dimension of the organization, so across all levels of the staff and in all the departments. So it should be really interesting and fruitful. And as I mentioned, the Elder Services of the Merrimack Valley presentation spoke really well to how that type of change specifically will look for an organization like us. So I think we'll definitely want to return to that material again. So although the immediate barrier is sorting out the consultant situation, I'd say that in general, the delays and the stalls are at least partly due to competing priorities for our staff's time. I'm sure that's true for everybody. And if we had all the time and money we wanted to, I don't think we'd have quite the same degree of delay. And then ideas for facilitating change. One great approach that the Elder Services team described really well was the value of breaking it down, educating everyone on the reasons that we're doing this type of organization-wide review, motivating everyone, showing how making those changes are going to be important to each team's specific purposes, not just the organization mission as a whole, but how that looks for each team. And really, you know, taking advantage of this time delay that we have right now, we could really be starting this conversation, and I think that would be a really good idea. So focusing on internal communications and building that awareness, the buy-in, the understanding, you know, we could really be taking advantage of the enforced break that we have right now, and sort of focus on those elements of the change. That is where I think we're at right now.
Thank you so much. That's really helpful, and I'm sorry for our short technical difficulty there. but it was great. We heard the majority of it, so that was really helpful. Okay. All right. Oh, let's see. So we will go on to sound generation.
That was sound generation. I just spoke.
I'm sorry, Megan. Had it on the wrong side. We'll see if we can go back to Oregon. We'll try.
Can you hear me?
Yes, we can hear.
Hello, this is Lavinia. Can you hear me?
Yes.
Okay, I'm on the phone now, but I still hear a lot of feedback, so I'll just try to speak slowly. As was mentioned by sound generation, we have had a little delay as well in contracting currently with a provider to do our technology piece. I'm learning through this process just how complicated it can get. So I actually have tapped on some different resources just to see whether or not what they're asking us to do or being placed is appropriate or realistic. And I guess some of the things are quite common. So, and the one thing that has come out is that we're looking at this organization, the systems organizations to help us do some third-party administration of our claims and also to access their EHR, and have been told that there can only be one third party involved with one tax ID number. And I don't know if that was something that I was unfamiliar with, but apparently it's a common practice. But that does present us with some challenges. So we're trying to work through that. I think that in terms of change, that's the immediate one that we need to address. At the systems level, one of the things I'm noticing is that, when we go through these strategies to bring up people's awareness, get their buy-in, and so forth, that's great. But then over time, people change their positions or they leave, and we've had that occur in the last couple of months where some key people have left, and it sort of takes you back to square one. And it's hard not to get a little bit, frustrated with that process. But, trying to keep our eye on that goal has been our biggest challenge. So in terms of, I think I put down hiring of staff to support fiscal activities, data management. It's just getting enough people on board to help with all of that. We have made some progress in terms of that, but we still have a number of steps to go. And most important, near-term change, managing, prioritizing what needs to be done, recognizing we need. Yeah, I think that's really at the systems level, getting our organization to understand, and our organization is comprised of 16 area agencies on aging, and we basically have some early adopters, and we have a number that are still, not even out of the starting gate. So trying to get everybody on board continues to be a challenge. And then in terms of, let me see, ideas to foster change, we are, as I said, bringing in a consultant, and he's already been quite helpful with that process. And then identifying, educating change champions at the executive level for this work. I think that continues to be, because some of the management at the AAAs have also changed. In fact, I would say about 40% of them have changed. So as a result, it's, you have to go through the education process again. So that's where we're at. Any feedback?
Thank you so much. I wanted to ask just a question about, you mentioned, staff transitions and staff leaving, and then kind of gets frustrating. You have to go back to square one. What are you thinking about in terms of putting in place to help transition that? Is the consultant helping with that, or are there other mechanisms you can put in place to help transition that change quicker?
I think, the experience that we've had has helped a lot. So we have a lot of the materials that help to support that. We have and I think the fact that we've had one, I guess more or less, at least a full year's experience, we can draw on those successes and use that to help with the change process. I think, I don't know, so I don't know what else there. I mean, we are trying to bring in this consultant to do a presentation to the board, so that, again, trying to get all of, the leadership on the same page. And I think that will help a lot. When, there have been a lot of things happening at the, federal level, at the national level, that has, these leaders, they've been said to me, I went to this conference and they were talking about things that you've been trying to tell me about for the last 2 years. And it finally, aha, right? I had that aha moment, or it finally put everything together for me. So maybe the stars are starting to align, but I'm just afraid that, there's an opportunity here that if we don't, take it, we're going to miss the bus.
So it's really about that sense of urgency. And, one of the things that I would encourage you to think about doing is, and all of you actually, so for example, the presentation that the consultant's going to do to the board, recording that, audio or video recording that, so that if you do have transitions and changes in staff or some people miss it, you can play it for them, or they can listen to the audio. How you can document certain conversations and pieces, or if there was a great presentation or there's a great article that reinforces what you're talking about, any way that you can put all that and compile that into an electronic file folder, store it together so that you have these sound bites and these pieces ready to share with someone who missed it or who needs reinforced again. Those are some of the ways that you can make sure everybody's getting those really important messages.
Right. And I did do that a little bit, because he had a PowerPoint, and not everybody could make the meeting, so I did send that out to folks. But there's something about actually being in the room and hearing it and listening to the dialogue and the questions. So I think recording it would be great. That's a good idea. I'm going to do that. Thank you.
Yeah, we have really good luck with those cheap little audio recorders, or even recording on your cell phone. Just remember, you have to let people know that you're in advance, that you're going to be recording, and make sure you have their okay. But it's a great tool to catch people up quickly. So thanks for sharing. We'll move on now to ASWA.
Hi, can you hear us?
Yes, thank you.
Can you hear us? Okay. So this is Whitney with ASWA. So one of the biggest changes that we need to implement is inviting our other program staff and our internal stakeholders in our data process. Until now, it's just been a small group of small group of 3 of us, or sometimes 4 of us, that have been looking at data and how to integrate the different platforms and how to synthesize things in Tableau. And we're really reaching a point where we need to get buy-in from the stakeholders and get program staff involved. And some of the barriers, like everyone is dealing with, are you know, not having enough time, seeing this project as more work for them, or drawing on their limited time. And so we've done some, as part of what ideas do we have to facilitate this change, we've done some presentations about, we've done some presentations to our extended management team about data, and just showing different functionality of what we could do with Tableau to help them monitor their programs. And just yesterday we were talking about this October our management team is meeting to discuss the budget and the strategic plan for the following year. And we were talking about developing a long-term plan for data. We kind of got started doing a pilot program of short-term limited projects, and we want to make data more of a long-term integrated piece of the agency. So we talked about building data into quality assurance for the different programs, and getting different program people involved in developing Tableau dashboards for them to view different pieces of their programs, to develop performance indicators and kind of measure the efficacy and the quality of the programs in that way. And some of the barriers to that kind of change are that it's a huge paradigm shift. It's a different way of thinking about a lot of the programs for the AAA that's used to just performing the work and collecting payment for it and just, you know, reporting to funders. It's a whole different way of thinking about kind of being in the driver's seat of where we're going and looking at our data in a more impactful way. So essentially what we're trying to do to facilitate this kind of a change in our agency is really just getting those buy-in from upper management, doing presentations, and trying to make them see how helpful data could be to them, so that they don't see it as a drain on their resources and time.
Yeah, those are some really big paradigm shifts, as you mentioned, and I would encourage you to think about how you can engage and involve staff in, you know, developing some of those performance measures, and really seeing why that's important to them, because, you know, being able to get to the heart of what they're passionate about and what's important to them and how this data can help that happen. Because a lot of times in developing performance management systems that I've worked on for many years with folks and helping to facilitate that change, they see it as something, A, that is extra work for them, B, that is going to be focused more on their performance, or catching them doing something wrong, or, you know, that data is going to be used against them in some way. There's all kinds of fears about it, and so surfacing some of those and getting them out on the table to clarify myths and you know, misinformation and misunderstandings about how the data will be used is important. Talking about how it can be integrated into daily work, or, you know, what something else that you might be able to give up is, are there some sorts of, you know, laborious reports that they will no longer have to do because this will take the place, you know, what's sort of that give and take. Those are some of the types of ways that you can build more of the desire and the commitment towards a big paradigm shift and change like that. So I'd encourage you to take a look at some of those options and involving staff earlier on, rather than after you've already made all the decisions for how it's going to work and what those performance measures are.
Thank you. That's great feedback. I think that will help us when we're moving forward trying to get buy-in with the agency. Thank you.
Oh, okay. Thank you. Thank you. All right. We will just move on now to live stream.
Yeah, this is Paul. I'm assuming everybody can hear me. I know there's been some
We can hear
audio
you.
issue. Okay, great. So yeah, we've had quite a few changes as well. So basically where we're at now is Jenny decided to hire a business development person at the senior staff level. And a big part of that was being able to look at building out a business case and some of the actionable data that they can drive on. So now they've gone from basically a lot of different spreadsheets and trying to look at traditional processes, and now starting to trust more of the modern approaches to data. So she keeps reviewing that. Another big change has been reviewing just how much money is being left on the table. So even with traditional services or new funding streams, just what's the market opportunity for that? So a big change with that would be marketing, right? Trying to identify appropriate populations who would enroll in your services, et cetera. Referral programs for value-based payment models and those types of things. And there's another big change that seems to be coming with the social determinants of health is the more and more we look at some of these different return on investment models and risk stratification models that go into play, the verification or validation behind just how much value a social service agency can bring to a community, the numbers almost seem ridiculous at times, especially depending on how large of a population you're serving. So trying to kind of effectively communicate just how we came up with the information, how it's being analyzed, what supporting evidence is behind that, and then what programs to start out with. So maybe it's a transportation or a meals program, but always keeping in mind that you want to move toward managing population health as a whole with like a PACE program or hospital systems. So I would say the messaging is starting to change. And then how we look at the data holistically instead of just internally, but what external sources and then the information from various departments and how they influence each other. That's been very eye-opening. And it seems like the more we clean up that information, the more consistency we get in how the data is being collected, the more revealing and just basically blatantly obvious what needs to be corrected, which is a big change from before. Before it was just kind of, hey, looks like something's going wrong here, or we're getting complaints about XYZ, so that must be true for everybody else. So instead of taking that approach, kind of digging into the numbers a little bit and just gaining more trust from that information. So, and along with that, building community partnerships is becoming very obvious. That one agency is not going to be a one shoe fits all for people. So how do you communicate with current partners, and what type of partners do you need to engage with? So maybe you're used to working with home health agencies, but there may be some value in working with like your local Goodwill or your public health department, something like that. So that's been really interesting as that's been communicated to senior staff. And then last but not least, it seems like the timing is really critical at this point to be able to leverage data, and not just data, but how you can adapt that data for the environmental changes. Meaning you get information 1 month and it looks a certain way and you have a certain confidence level in that data. But as you learn more about the populations and the techniques or evidence-based models that can refine your process, being able to re-crunch those numbers and reprocess that information quickly, you can tell there's going to be a pretty big gap between agencies who can leverage information rather than trying to react to different things. So Jenny's been very forward thinking and trying to figure out what's the additional information we can get from various sources, like maybe there's new applications with the Health Information Exchange or new technology that's coming out, such as encrypted text messaging between hospitals and their staff. Where are people generating referrals from? What type of new systems are they moving toward? And then how can you be a part of that discussion, especially as it relates to data? So, and it's a lot of data. So that's another kind of unique approach that maybe hasn't happened in the past, is really trying to get as much of a big picture view and then recognizing where you fit into that picture, and then communicating it to staff about why it's better to have potentially somebody staffed at a local hospital and enter into a contract with that hospital, and how it generates better outcomes for patients in another department, et cetera. So, yeah.
Yeah, being able to demonstrate the value for that change. So you shared an awful lot, I think, of what you're working on and facing and the challenges you're facing. And I would encourage you to think about really using some of the tools to develop a change management plan around some of those things, because it's so much, it's so big right now. It would be hard to think about where you're specifically would use the tools specifically. And the other question, I made a note that when you were talking in the very beginning, you said, as it relates to social determinants of health and ROI models and risk stratification models, you said something about the numbers related to the value can seem ridiculous, and I wasn't sure exactly what you meant. So can you explain that a little bit?
Yeah, so when you look at especially some of the newer value-based payment models that are coming out with like physicians groups, and the risk shared models, it seems like CMS or other insurance companies are starting to recognize payment toward high risk populations or just populations in general that are being served. They're basically recognizing there's a lot of value that can be saved and earned if you can implement those preventative measures, et cetera.
Okay.
So when you
gotcha.
shift the dollar,
that's what I thought you meant.
Yeah, yep. And they can be like 10 to 1 at times, depending on how much you're able to provide and how far upstream you can capture those populations.
Okay. So using that data and information is helpful to demonstrate the why and the value, but also getting people to believe and comprehend that as well could be challenging.
Correct. Yep.
Okay, great. Thank you. We're going to move on now to LSA.
Hi, this is Swati Manem. I hope everyone can hear me. I've been having some audio issues on my end as well. Can you guys all hear?
We can hear you.
Okay, fantastic. And unfortunately, quite a few of my team members had to get off, and they let me know that. But just giving you heads up. So for our work plan, some changes that we needed to see near term was to getting clinicians to use existing and new technology in an efficient manner that satisfies clinical needs and compliance. For EHR, we're starting in January. We'll be using Simply Connect as an electronic marketplace for referrals inside and outside of LSSI with our provider ecosystem. Some barriers for this change management process, as well as mitigation compliance and risks around consent management are our main barriers. And what ideas have helped to facilitate this change? We've really enjoyed, and we felt like this collaborative material from this collaborative has really helped us, especially around consent management and business processes. We've had some great calls and great one-on-ones kind of to understand and get a better idea of that. We have learned to streamline and strengthen our consent process. I think furthermore, by implementing constant training, we will be sure to ensure our staff understands consents as well and what's required for compliant referrals for our ecosystem of providers, and to ensure that our clinical staff are following consent policies and using new electronic tools rather than legacy processes, which they're comfortable using. And being comfortable in an uncomfortable change is really important, and we want to continue that message. And it's okay to not be comfortable. We understand that, but we hope we can help get them to a place where they are, which can help compliance and more efficiency to serve our clients.
Great. So you mentioned one of the most important pieces in that change management was the training, and more training, and really trying to understand some of the complexities and barriers, the user perspective. So yes, that's great. Thank you.
No problem.
And then Pima.
Yeah, we've ended up in kind of a waiting pattern. A lot of what I talked about last time was about how we're working with the state folks to implement the changes that we're looking for, and possibly across the state and all the AAAs. So they had a lot of projects that they wanted to get done in the first quarter of our fiscal year. So they've asked us to hold everything off until the second quarter, which is coming up soon, starting in October. But we're using that time for us to prepare. And I mentioned in my chat earlier about implementing Potter's 8 steps. So we're doing some of that first, and preparing our management staff for what we're doing. And we're also engaged. I mean, it works out for us pretty well because we're in the process of a physical move too. We're moving staff from one rental building to two buildings, one our existing one and one that we've purchased. So there's a lot of movement going on. So it's better for us to get that behind us, we feel. But otherwise, we're getting still very positive feedback from state folks that they're looking at our changes and believing that they're useful statewide. So that's a big plus for us. So although it pushes our timeline back a little bit, it's heading in the right direction. So one thing we have realized that we have to do is scale back our analytics expectations, unfortunately. That is something the state has made clear to us that they're not prepared to do at this point. And we don't think we can take it on financially on our own. So we're coming to that decision right now. We're not kind of finished with that, but so that's really where we are. Is that we're using this period to prepare and focus and hopefully implement a well-defined plan going forward once we get back with the state and their projects are behind them.
That's great. I think that some of the readiness assessments will be really helpful for you in this stage to just get a better understanding of what some of the communication needs will be, some of the anticipated resistance, several of the pieces. So I think taking time during this quarter while the state's asked you to wait will be great to do some of that. And in addition, you mentioned the move. There's so much change that people are experiencing with a move that you can even, as an organization, try out some of the change management tools during this move to get people ready and have a smoother transition adapting to new space, because believe it or not, that does impact productivity quite a bit.
Oh yeah, yeah, it's a lot, and I think that you're right. It's a good idea to start using those tools through that process too.
Yeah, so taking a look at just the ADCAR model first for individual change that individuals are experiencing, and as well as Cotter's model for the organization change would be helpful. All right, we're going to go to our last team now, Michigan State University.
Yes, I'm here. This is Dawn Opal from Michigan State.
We can hear you. Great.
Oh, good. Okay. So, I talk here about our change management situation, and I think that the grant that we are on for the programming that we're involved in the Upper Peninsula of Michigan has two stakeholders that we're trying to work with. One is a payer, healthcare payer, and the other is another that is the AAA. And so in order to advance our work plan, we sort of have to keep developing these relationships with these two stakeholders. And they themselves have a long history themselves of contracting that has changed over time and gotten somewhat complicated. And we sort of are in the middle a little bit as another CBO. So one of the things that, we are learning more about this. In fact, we sort of wrote this grant proposal and began offering programming up in the Upper Peninsula before we really knew what this long history was. And so really what they contracted was for services for case management versus utilization of services or programming. So anyway, so we sort of learned that this existed and we didn't know about it. So we're kind of learning that that our lack of sightline on some of these histories has prevented our ability to pursue the sustainability of our own programming in that geographic region. So actually, I just lost my slide. I think I'm seeing Lori's.
I did. I was looking up a tool for you guys while you were talking.
Oh, that's
I wasn't sure you needed.
Oh, sweet. Okay, I'll keep talking then. No problem. So we're thinking more. I think that this relationship building that we're doing is going to take a little bit more time, and we're going to need to work a bit more incrementally. But we've had now that we sort of understand the more about the culture and the relationships that we're working in, we're starting to understand, how we can move forward. And so we're looking at now sort of changing what we're asking for and changing these conversations a bit to reshape our relationships together to be about different kinds of initiatives, I think, than just reimbursement, which tends to be what we were focused on at first, to think about sustainability of this programming long term in that area. But we're now thinking about more of a proof of concept and how to move incrementally and sustain ourselves in other ways first. We think we're getting there and we're making small moves forward, but this idea of how to learn from past mistakes and grow with is sort of the work that is ahead of us, I think, right now for change management.
That's great. Thank you. I wanted to share, you just brought me, when you were talking about the two distinct stakeholders, and I thought about this before when someone else was talking as well, about a tool that I think would be really helpful, which is a stakeholder analysis tool related to change management. And so I just wanted to show you that real quick.
Cool. Thank you so much for this.
Oh, shoot. There we go. So yeah, it really talks about the fact that when we have these types of challenges, this is for an adaptive challenge, but it's still the same as change management. It's a similar tool, that there's losses, loyalties, and values for all of our stakeholders. And just taking a few minutes to define those and understand those is really important in managing change. So I think this can be a useful tool for some of you as you're looking at the differences between those things for various stakeholders who are part of your project. So we'll send this out as an electronic form that you can use. But I just wanted you to have take a quick look at it. And I think it could be helpful as you're thinking about the change management and how that differs between the two stakeholders that you're talking about.
Great, thank you so much.
Sure, thank you. All right, well, hopefully we didn't go over too much. Yeah, we went over a few minutes. Anna noted in the comments that if you have any progress updates or anything that you didn't already share that you wanted to share or an announcement, please type that in the chat log. We are running just a little bit behind on time, but if you have something, please do share. If there's any achievement or progress that you didn't mention when you were talking about the changes and the barriers you're dealing with or any announcements, you can go ahead and type that in the chat log and we'll make sure that everybody sees that. And then I'm going to go ahead and turn things over to Anna and Lauren. Lauren has from ACO has an announcement to make about the project closeout. So Lauren, did you want to go ahead now?
Sure, I'm happy to.
I wanted to just make one more quick comment here. If any of the presentations on the change management issues sparked anything for you with any of the other communities and you have follow-up questions for them, feel free to either chat those or email them to us so that we can be sure to connect you for follow-up later. Okay, sorry about that. I didn't want to lose any momentum or excitement about the change management problems that you guys were starting to unpack, because a lot of them, there was a lot of overlap between some of the issues you guys are facing. So just to kind of outline the next 10 minutes, Lauren's going to talk from ACL, and then we'll just talk about the remaining components of closing out the Learning Collaborative. Great. Thanks, Lauren. Pass it to you now.
Okay, great. Can everyone hear me?
Yes.
Okay. So thank you all so much. I just wanted to take a minute or two to express our appreciation for your participation in this Learning Collaborative. I know you haven't heard too much from us, but I have been on all the calls and I've just been really impressed with your work and your commitment to, really tackling these challenges. And hearing your updates today and throughout the course of the work really further sort of validates your commitment into diving into all of this. We know this is not easy stuff. So again, we just wanted to thank you for your sort of dedication. This area of health IT and operability has been, an ongoing challenge, and it continues to be, and for CBOs, for their partners, for as well as healthcare entities that are trying to work together. So again, we're just really grateful for your efforts. And I also wanted to share that ACL will also be, going forward, we will be continuing with this work. I think it was maybe in Lavinia that mentioned her colleagues hearing, this message at a recent national conference, but our administrator Lance Robertson really has been sending the message that this is undoubtedly a strategic priority for ACL. We will be continuing to invest in business acumen, and we'll be implementing a new contract that will, further help to support and leverage all of the great work that has been done thus far by the Aging and Disability Business Institute, by some of our other partners, by Advancing States. So there will be a lot more to come on that. Health IT will also continue to be an area of focus. And I also, before I close out, I just also wanted to recognize and thank IPHI for all of your efforts and work to facilitate the group. You really have done a phenomenal job, we think, in keeping the collaborative members on track and helping them to work through their work plans and defining project goals. We've just really been impressed. So thank you so much for your efforts as well. And I think that's really all I had to say. I just wanted to, again, just take a minute or so to express our, you know, our gratitude for your work here. And we look forward to, I think there'll be an opportunity, maybe n4a will share, for us to come together again in the future, but I'll let them share that, but just thank you again.
Thanks so much, Lauren. We really
I would like
appreciate
to
it.
pass it now. Oh, sorry, Lori.
Oh, I was just saying thank you, Lauren, and we've really appreciated the opportunity to work and learn with all of the teams, so thank you.
Yes, we've really enjoyed this opportunity and have learned a lot ourselves from all of you. I think, Maya, if you're available and on the line, if you can speak about next steps before I do the closeout, that would be super helpful.
Sure. Hi, everyone. I echo a lot of the thanks and appreciation that Lauren shared earlier to you all and your dedication to this learning collaborative. I know we've really appreciated working with you all and have learned a lot as well. In terms of next steps, we are planning on having an in-person meeting with you all as part of the Health IT Learning Collaborative, with our Trailblazers Learning Collaborative, which you've heard about, and our third learning collaborative with the Medicare Advantage group. So right now we're working on finalizing details to share with you, but at this time we ask for you all to save the date for December 3rd and 4th. The meeting will take place in Washington, D.C., and we will be providing kind of travel information and more details very, very soon, but we just wanted to make sure you all knew about it so you could save the date. And I don't know if Marisa or any of my other colleagues wanted to add to that before you wrap up, Anna. Maybe not. Go ahead, Anna.
Anna? Anna, I'm not hearing you.
Can you hear me now?
Yes.
Okay, great. What I was just saying is that this does change a little bit of our kind of closeout plan. We are still moving forward with finalizing the products, but more to come in terms of if that in-person meeting might be an opportunity to get feedback from you in a room together, face-to-face, to talk about the content before it's finalized. The evaluation, I think we can still move forward with in terms of your reflections overall on the structure of the Learning Collaborative and the webinars, as well as your reflections internally on how far you've advanced your vision and your learning objectives coming into the collaborative from last fall through now. So we will send an electronic survey for feedback from each of you, and it'd be great to have your team participate in that. So there's the evaluation coming, we're wrapping up the final products, and we are still working with n4a to figure out what that in-person meeting may look like in terms of weighing in on some of the deliverables that we've already been working on up to this point. So next slide, Lori. I think all we have left here is thanks everyone for your presentations today. It's always nice to hear from all the teams together. We have a final evaluation at the end for you to give us feedback on the content presented today. And as I mentioned, these are just a couple of the outstanding items as we move towards wrap up, but know that we have one more opportunity, really a celebration and reflection about leveraging this work to meet in person in December in DC. So more to come on that. We'll go ahead and send you a save the date and so you can block that time in your calendar now. So thanks everyone for accommodating the change in schedule, and do complete that evaluation when it pops up. Thanks again, and have a great rest of your afternoon.
Anna, we do have a question. Not sure if we're able to answer it yet for Maya. Will there be funding for the in-person meeting in terms of, probably supporting training, travel?
I think that is still TBD, but that is what is being currently determined and worked out.
Yeah, actually, hi everybody, this is Marisa. Sorry, I didn't jump back on fast enough before to be able to jump in when Maya asked for any additional feedback. Yeah, we will be able to support at least one member of each of the collaborative, actually of all the collaboratives, to be able to attend the meeting. There's a possibility of more, but we're figuring out exactly the amount that we have in terms of travel allocations to be able to offer to all of the learning collaboratives members. So know that we will pay for at least one person and possibly two to attend the meeting.
Thank you for that clarification.
Great.
All right. Well, we will conclude the webinar, and as Anna said, we'll send out a hold the date in Outlook for you. Thank you.
All right. Thank you.
Thank you all.
Thank you.
Thank you. Take care.
Thank you. Bye-bye.